parents are trying to make the best decisions that they can for their families. And when they get bombarded with misinformation, with things that are just straight up lies, it's very hard for them to be able to navigate through that.
Welcome to Wonk. Measles is making a comeback in Canada. The numbers are still small, 1,500 cases at the end of last week, mostly in Ontario, and so far there are no deaths. But since measles was considered eradicated back in 1998 in this country, it feels a bit shocking. Is it part of a bigger trend we're seeing of vaccinations declining? Well, maybe. We do know there's a cohort of young children who may have missed early vaccines because of COVID. There's also some evidence that vaccine skepticism is growing in general. We're talking today with two health experts. Dr. Joss Reimer is president of the Canadian Medical Association, and Dr. Michael Gardam, a leading infectious disease expert, former CEO of P.E.I's Provincial Health Authority. Thanks to both of you for being here.
Thanks for having me.
Thanks so much for having us.
Let's start with, and I'll kick it to you, Joss, first, perspective on what we're seeing. It feels terrible to see a disease that we thought we had vanquished reemerging. What's your take on what we're seeing?
Well, it's just like what you said. It's a disease that we had eradicated from Canada. We had had a successful vaccine campaign over many decades with lots of great effort and lots of buy-in from the community. And we also know that measles is incredibly infectious. So we've known for a while that our rates weren't at the level that we needed them to be to guarantee we had continued protection. So in some ways, it felt like it was a matter of time before this happened. But then with the pandemic, with the vaccine fatigue that we're seeing, with the kids that missed their doses during the pandemic, because we in public health really weren't able to focus on anything other than COVID, that was just the recipe for this to be the time for it to come back. And it's really devastating to see. Children are suffering and having really severe illness for something that we could prevent.
Michael, your thoughts on it? And this, it feels a bit flabbergasting. And the reason I said it's small is because it's not in the broad population. It feels contained to a couple of communities, but still the potential for high risk is there.
Yeah, it's really the great tragedy of public health measures, right? If they work extremely well, then people forget what the disease was, and then they think, well, why am I getting this vaccine? It's very analogous to taking fluoride out of the water, right? When fluoride was first put in the water, that was a big deal. Mm-hmm. People had a lot of tooth decay, et cetera. Now, everybody's talking about, or people are talking about taking fluoride out of the water. So, this is part of the cyclical thing that happens with either communicable diseases or other public health issues, that when it goes away, people either don't care or they worry about the side effects, even if they're minuscule from the vaccines, et cetera. They stop doing it, then they come back. And, I wish human beings were a lot more logical than they are, but this is not the first time we've seen something like this.
Education feels like a big piece of the puzzle, and we had these illnesses that killed people at a kind of a steady clip, and we've made such great progress. Michael, I'm going to start with you. I want both of you to weigh in on kind of how the pandemic reshaped the relationship with vaccines and how sticky that has been in a way that, I don't know if it surprises you, but it's definitely lasting longer than some of us expected.
Yeah. Honestly, none of this surprises me. This is kind of where I thought the world was going to go after the pandemic. Not only did we have a pandemic with a novel virus, but we also had it during the social media age. And so the amount of negative influence on vaccination is just instantaneous, right? And there's large numbers of people whose one of their main reasons for living is to prevent you from getting a vaccine. And they will work very, very hard at that. And so, you add that with the other sort of public health control measures, such as social distancing, shutting down restaurants, et cetera. And there's people who may have gone along with some of this, but at some point they lost it and they just went negative. And, there was a bit of this, when you look at other outbreaks that have occurred in the world at different times, this kind of thing happens. People get very fed up. They don't want to hear it again. And there's a period of time where it's very hard to get people back. And you just hope that we don't have another pandemic in that interval.
Joss, how much of this is just education that we didn't manage to get done in pandemic? Maybe we didn't have time, so, fair enough. But that we didn't really follow through on to try to really reach people, and not in a not in a lecturing way, not in a heavy-handed way, but just here's all the facts, and then you take it home and make a rational decision.
Well, I think that's just it, is that parents are trying to make the best decisions that they can for their families. And when they get bombarded with misinformation, with things that are just straight up lies, it's very hard for them to be able to navigate through that and figure out what's the best decision for their child, because they get these terrifying messages that are shared with them about people dying because of the vaccine, when in fact we know that they're dying from the things that the vaccine is preventing. And so it's not even that they're not educated, it's that they're being overwhelmed with miseducation, with things that are trying actively to lead them astray. And combine that with the fact that, we stopped doing a lot of our school-based immunization programs during the pandemic because we were so focused in on COVID. And a lot of families lost income. They're having to refocus on getting things back together. And so it can, even for those people who aren't anti-vaccine, it can really drop down that priority list and be very hard to get people to take that step to go and do this on top of trying to figure out how they're going to get their income, how they're going to feed their kids, how they're going to pay for their rent, figure out housing. And so there's a lot of things going on at the same time for families who are really just trying to make the best decisions for their kids.
One of the things we didn't really do, for those of you who are in the trenches of this pandemic, I think we know why we didn't do it in real time. You were busy. There was way more important crises, fires to put out. We haven't really, Michael, done a good forensic review of the pandemic.
No.
And included in that, maybe you won't agree, I think if we did it, we might include where we went too far, where we might have done less, where we misdirected our attention. And that actually might help make the case for vaccines in other ways, if that makes sense. In other words, maybe some of the vaccine mandates did go too far. And if we admit that now, it wins people back.
You don't want to overplay your hand in public health, right? The second you overplay your hand, then people are going to go, aha. Remember when you told me that I couldn't go to the park and it was 6-foot distancing and that was probably garbage? Well, I'm not going to believe anything that you said now, right? And some people will do that because they're looking for any little wedge that they can possibly find. I do agree that there should be a really serious debrief looking at what went well, what didn't go well. Closing schools, very controversial thing. Was that necessary? Was it necessary throughout all the times that we did it, or maybe just in the beginning? You could learn an awful lot from this. My exposure to debriefs, though, has been incredibly political. It's just been, what you did was wrong and you took away my human rights and this is just all awful. It's like, no, the world's never black and white like that. There were definitely some things that if we could do it again, maybe we wouldn't do them the same way. I personally found that, having lived through SARS in Toronto, where we brought a lot of these SARS-ian control measures, that they actually came back for the pandemic, and not all of them made sense to me. But it's like, well, that's what we did last time, so we'll do it this time. The other challenge, of course, is that you don't always get it right. And so you constantly have to re-evaluate what you're doing and, if necessary, change course. But it became so political that you couldn't change course, because if you did, then you were wrong. And what do you do with a culture like that right now?
Yeah, I mean, Joss, that must be part of it, right? We're just afraid to go back and review but it seems so limiting to me that we shouldn't go learn from our mistakes. We made mistakes. Economically, we made mistakes. I'm not just talking about in the healthcare profession. We could do it differently. And I'm asking this in the context of what I understand from the scientific community to be a near certainty that we will face a similar kind of health crisis somewhere in our future, our collective future.
Yeah, that's exactly what I was going to add, that this is not a matter of if we have another pandemic, it's a matter of when. And we're certainly hoping that we've got decades before we face something like this again, but there's no way to guarantee that. We really don't know. And so having more information about what worked, what didn't work is really important. What I would say right now is that most people, I think, just feel burnt out from all of this, and nobody wants to go back and do that work right now because of how hard everybody on all sides was working, or how hard they were being affected affected by not being able to work, for example. And so it's been really challenging to get people to want to do that deep dive, even though we know that there's so much we could learn and that we do need to prepare for the inevitable next time something like this happens.
Yeah.
One of the places, and I'm curious, and I don't even know if, as people that were, at the front line of this, you even feel comfortable talking about it now. But one of the places I think we could have a very healthy debate is whether the mandates went too far. We put people's livelihoods on the line. And I think that's where we saw the real kind of kernel of anger begin. It's countered against bodily freedom. And when it comes to our children, we take that even more to heart. We want the freedom to choose for our kids. Given that measles is, I think, am I wrong about this, way worse than COVID in terms of its deadliness, it's the way that it can spread. I mean, if we go back to the kind of pre-vaccination state of measles, it's way worse. Where are the mandates? And what should they be, Michael? If you were designing a measles mandate, what does it look like?
Yeah, it's a really tough one because we've generally, even when we had a vaccine mandate, it wasn't that you must get a vaccine. You're allowed to not get a vaccine. It just means you may not be able to do everything that everybody else does, right?
Mm-hmm.
Even when I worked clinically in tuberculosis and I had somebody with highly contagious TB, multi-drug resistant, refusing their medication, public health still wouldn't force them to take the pills. They would just remove them from society, which is
Right.
pretty harsh, right? So I think that as a society, I think we've kind of spoken and said that we're not going to hold you down and vaccinate you. I don't think that a lot of people would agree with that, even though personally, what's the big deal about getting a vaccine? But I understand that holding somebody down and vaccinating them is a very different scenario. I think we just have to decide what our policy is going to be and actually follow it. So if we mean that you need a complete vaccination record to go to school, as we know, a lot of jurisdictions just say, yeah, we want you to have it, but we're not going to enforce it. Well, having been a CEO in my career, if you got policies that you don't enforce, they mean nothing.
Right.
And so, measles is something we've got hundreds of years of experience with. There's no ambiguity in terms of how it's transmitted, how infectious it is, how well the vaccine works. The vaccine's been around for over half a century. We should be able to hammer out a pretty solid, scientifically thought out policy on this. And I think it's just perhaps lacking a bit of political will to go there because, oh my God, we just had COVID. We don't want to go there right now.
Joss, what would you recommend? What's the policy change we might make? Like, let's stick with measles. Do we do enough in terms of schools, for instance, of demanding that people have their vaccinations up to date? I think there's still some wiggle room there.
Yeah, and schools would definitely be the place where you would have the most impact for having a policy like that. So, Ontario already technically requires kids to be vaccinated to go to school. But like Michael was just saying, if it's not enforced, then does the policy really matter? Many other provinces don't even have that policy to begin with. That certainly is a place where you'd get the biggest bang for your buck. And some of this is a scientific conversation, and some of it is a societal conversation where we have to make decisions about how comfortable we are having other people's decisions affecting us versus having society tell people that they can't participate in certain things because their decisions affect other people. And that's hard for any physician, for any healthcare administrator to make that decision because you really are weighing. I mean, if we separated everybody into bubbles, we would eliminate most infectious diseases, but nobody wants that life.
Right.
And so where do we find something in the middle between, we don't want people drinking and driving. We don't want that type of harm coming to people. And so we've all sort of accepted that's an acceptable limit on our freedom, our personal decision making, because it puts other people at risk, all the way up to nobody can interact at all. And we have to figure out in the middle, where do we find an acceptable balance of how your decisions affect my risk versus how my risk impacts your freedom to move around society.
There was a poll done not long. It was done a year ago, actually, February 2024, but certainly with a good distance between it and the pandemic. But the difference between the way people felt about vaccinations in 2019 and the way they felt in 2024 is startling. And to me, the headline is the number of people who would vaccinate their children, just yes, I will, was 88% pre-pandemic and 67% post-pandemic. And
Yeah.
one of the things I find so fascinating about that is I think that that's a higher number even than we see, like the vaccination rate is higher than that implies.
Yeah.
So people are saying they're against it, but they're still doing it, which is kind of its own sort of tale. The story on vaccinations has lost kind of currency. So what's
Yeah.
the best way to tell it?
Just to go back to what we were talking about a few seconds ago, one of the issues, of course, is that I think we probably overplayed our hand with the vaccines. Or in the first wave, once we got those vaccines, I mean, they were truly life-saving. And not only were they life-saving, but they also actually prevented transmission. They were a really big deal. As subsequent waves went on, though, the relative benefit of the vaccine reduced because more and more people were getting protected or they had already been infected, and they weren't preventing transmission anymore because the viral strains were actually mutating in real time. So at some point, the heavy-handedness with the vaccines probably should have pulled back a bit because it had gotten a bit ahead of the science. And that here we are now, right? Where I think people
Yep.
feel like you misled me. You took me too far down that road, and I'm not gonna trust you anymore. And this concept is called misleading towards the truth, and it's been around for years. Where if you overplay your hand with public health messaging, you galvanize opposition. And so part of the way back, I think, is again to have that really honest mea culpa, sitting down, talking about what we knew, what we didn't know. Nobody did that maliciously. It was done with the best intentions, but hindsight's 2020, and you learn and you hopefully do better next time. I think that debrief is what is so important. If everybody can check their egos and their pride at the door and have a real conversation about it.
I think, I mean, I don't know, Joss, is there a hunger for that in the medical community? I mean, I do feel like it's a bit of an obvious thing to do, including being able to say what got screwed up. Because to Michael's point, there are people out there who deserve to hear that we made mistakes and that they weren't wrong when they felt a resistance in whatever way. And it's a bit curious that we haven't done it.
Yeah, I think there's so much burnout in the medical community right now. It's hard to know if there's really an appetite for that. I'm not saying we shouldn't do it, but I know that there's a lot, especially because we have these ongoing challenges in the health system right now, where partially because of the impact of the pandemic, but not solely because of the pandemic, there's so much burnout just from providing healthcare in general these days. It's really hard to get people to want to go into something that is going to potentially be a bit of an ego hit and potentially be very challenging when their day-to-day is already so challenging. That may not be a good enough argument against it, but it is a reality that we need to acknowledge, that our health professionals are exhausted for multiple reasons, for the workloads, for the opposition that they faced, the protests that were happening at hospitals, the anger that they took online. There's a lot there. But I will also say that physicians are still deeply supportive of vaccines in general and are feeling very devastated seeing these measles outbreaks happening. And I think if we could convince healthcare providers that this is going to help with the measles outbreak, you'd see some buy-in pretty quickly.
I was just going to say, one thing that I think added to that burnout, which I certainly saw firsthand in Prince Edward Island when I was there, was the message that, okay, the pandemic's over, all you doctors get back to work, right? And it's not just doctors, obviously, but it was really hard for those of us in healthcare to kind of say, okay, it's back to normal operating. Only guess what? Normal operating is even worse now than it was before the pandemic.
Right.
There was never that ability to sort of catch your breath. It would be like finishing World War II and then immediately going into another war for us. Without kind of an acknowledgement, I think, at how tired people were. I spent many a long hour trying to explain to our politicians that there's a reason why it's not business as usual for everybody in healthcare right now. But it just, for most people, pandemic was over. And for us, we never really got over it.
That's a really important point, I think, because there was a real dramatic human toll. And I do think people's relationships with their healthcare providers has changed post-pandemic. There's a lot more remote interaction that may be better for the healthcare providers. I completely understand that. It may be better for some patients too. One thing I wanted to ask you two about is, as I sort of thought through this and you think about kind of vaccination and schools and how you prove that your child's been vaccinated, I mean, these yellow cards have to be the funniest thing, the most forgeable thing I've ever seen in my life. So
Right.
if you want to pretend you vaccinated your kid, it's not that hard. Why can't we digitize? I mean, I know our healthcare system is, well, along with our justice system, horribly undigitized, and we're taking baby steps in that direction. Wouldn't this be a great kind of sort of, I don't know, point of the spear to say we're going to digitize vaccinations, and that gives doctors a chance to be in touch with everybody, to get all their systems up to date, to actually make it a point of reference, Josh, where you can actually have everybody reach out and
Yeah.
all those babies that we missed. Now's the time we can call up the parents and say, we're updating our systems. You're behind. Let's get you on track.
One of the big challenges with the way health is provincial or territorial is that actually every province does this a little differently. So where I live in Manitoba, we are digitized. So we actually have all of our vaccinations back to 1980 is in an online database. So we can access all of that. Your doctor can see it. They can see it in the hospital. I just did a shift on Friday at the hospital, and we had somebody that we were worried about whether or not she might have chickenpox. And so I was able to just go and be like, oh, has she ever received a vaccine for chickenpox? And no, there was nothing in her file. So either she had it in a different province, different country, or she hasn't had it at all. This is really helpful.
Yes.
But I would say the gaps are huge when it comes to digital access to health information. And it's not just vaccines, it's everything in the health record. Alberta is probably the furthest ahead on this, where all of their hospitals share health data. But outside of Alberta, it's pretty hit and miss, where if I'm working in one hospital, I can't see what happened in a different hospital, what happened in the clinic, and we certainly can't see it across the country. So there are solutions to this. The federal government had introduced a bill that would have helped move towards a better connected system, but then prorogation happened. That bill died. So at the CMA, we're certainly pushing to see this as part of the solution, because we have countries like Spain, where across the whole country, they have shared health information.
That was a classic somebody in Ontario assuming that what happens in Ontario happens everywhere. But in my defense, I'm from Manitoba. In my defense, it's a huge populous province,
Yeah.
and it is way behind on this file. Obviously, resources for healthcare is a constant question, and directing those resources is only the second part of the problem. Finding them in the first place is often the first part. Michael, in this case, education does feel like the thing we need to focus on. Is that a big resource issue, or is that easily achievable? Are there things we could be doing right now that would help move some of that thinking around vaccinations broadly in the right direction?
Yeah, I mean, the literature says that, putting up a billboard saying, get your vaccine probably isn't going to get you very far. And these really are almost kind of like trench warfare, where you're going like person by person, and you're having conversations between the healthcare provider and the parent or whomever, and trying to reach a mutual understanding, and then going to the next person and going to the next person. It's actually quite labor intensive. And the challenge, of course, right now is, we don't have enough family doctors. We don't have enough anything in our healthcare system right now, due to what I would argue has been poor planning over the last 30 years. So it is going to be really hard to do that. And I think our default might be to have a TV ad or have whatever. But you know what? If you think that the measles vaccine is going to kill your child, or the COVID vaccine, harmed your elderly parent or whatever, then that ain't going to change your mind. And so it is a really challenging thing. I mean, the thing that I think frustrates me the most is just as Joss was saying at the beginning, there's like outright lies out there in social media. Like, they're not even nuanced, right? It's
Right.
just outright lies. And I guess we're okay with that we can just spread stuff around. Like, I really struggle with that. I struggle with social media in general because
Yeah.
it's just an absolute free-for-all. But it's a free-for-all that people pay attention to because they don't buy newspapers, they don't watch news anymore. That's where they get their information.
Is the answer to use it to advantage? I mean, should Health Canada be using, these exact same platforms to try to get even
Yes.
if it feels sort of manipulative, but to try to
No,
tell
absolutely.
the other side?
And we need both. It's a yes and. So we need to have websites like Health Canada, like the Public Health Agency of Canada, be trusted sources that people can go to and easily navigate when they're looking for information. But we know that a lot of the times they're not actually looking for the information. It is just forced to them.
Mm-hmm.
And so we also need to be in those spaces as well. Like Michael was saying, we need to be in social media, making sure that they're not only hearing the lies over and over again. Without the social media companies taking a step in the positive direction, though, we can't compete. It's so easy to spread a lie. The truth takes way more effort. And so
Yeah.
we have to be doing all of these things at the same time. We need to be improving the health system so people have access to the health providers that they trust, because that relationship is critical.
Yep.
While we're also doing the best we can on social media, and we're producing these reliable sources outside of social media for when people are not sure. One of the things you talk about education that there is some evidence behind is we're never going to be able to educate everybody on vaccinology. That's not the goal. But there is some evidence that when you educate children on critical thinking and media literacy, that can really help them to navigate through everything they're seeing on social media. And so that might be a better way for us to focus some of our education dollars, is to say, teaching people how to interpret information that's coming at them, because we can't control what comes at them.
Maybe they can teach their parents the same problem.
That's right.
What worries you both? Michael, I'm going to start with you, but because we do know there will be other public health crises, maybe it's the resurgence of a disease we've
Yeah.
already vanquished. Maybe it's a whole new, I lie awake some nights and worry about the permafrost melting and what the pathogens that are going to be released out of there. It could be a whole new pandemic. Given where we are with our lack of kind of agreement on this public behavior around these issues, how concerning is that?
I'm more concerned than I ever have been, because not only are the things that we've talked about, but we also have what used to be kind of the global beacon of public health in the United States be systematically dismantled. And
Mm-hmm.
not just dismantled, but being replaced by conspiracy theorists. Right? It's one thing to say we're not going to have a website anymore on vaccine information, but they've taken it one step further and said we're going to have a website on vaccine misinformation
Right.
and sell it as the truth. And it's horrifying to me when I look at what the CDC and others were involved in over the last 30 years, and that's vanishing. And I don't know who's moving in to take that spot. And so H5N1 is just a couple mutations away from jumping into humans. And when it does that, we'll hear about it in a matter of 24 hours. Like, it'll be that quick. And where's the CDC in any of that? Like, I that really horrifies me.
Yeah, I feel very much the same. It's with we've already talked about with social media, and then at the same time, seeing what's happening in the US with these devastating cuts to the National Institutes of Health. Even if we could turn back the clock and change everything right now, we're still going to see decades of impact to research, to learning about future diseases. They have stopped participating in influenza vaccine planning. And so they were a major source of information about what strains were going around. And suddenly that information's not coming. They made up 20% of the budget for the World Health Organization. Imagine suddenly that organization losing a fifth of their budget. They're doing critical work to prevent Ebola, to prevent so many diseases that cause harm all around the world. And to see that disappear, we're looking at decades of harm from what's going on there, because they did to give them credit, they over contributed to the world's public health science, public health awareness, and we've lost some really serious, really critical health infrastructure, information, and to be replaced with fear mongering, to be replaced with further attempts to undermine trust in institutions, that will seep over the border. We saw a reaction in the last federal election in Canada, but I think it's realistic to see that this is going to seep into Canada slowly, even though we had this temporary pushback, that we're going to start to see these trends replicate in Canada because we are so deeply in their ecosystem.
This point about kind of the loss of the research ecosystem, I think, is so important and well made. We can't, of course, because we're small, even if we devoted all the resources we have available to it, we can't compete with the level of funding the U.S. has done. They've been such a major player in this. But couldn't Canada and the EU and some other nations come together to, shouldn't we be doing that?
And I actually think that will happen. I think that, we've been living, you know, 80 years with the US. I mean, the reason the US was in that position as the world's steward, so to speak, is because they wanted that position. I mean, they intentionally went out and funded these things and took these positions to be the number one country in the world. If they're not going to do that anymore, other people are going to have to do it. I mean, there's also China, whose health research has just exploded in the last several years, and they're not nearly as far behind as I think the United States, thought they were. What role they're going to play as a international steward of safety, I don't know, right? But I
Mm-hmm.
think that there definitely are countries that have the scientific ability to step up and start doing things. They just haven't done it because the Americans were doing it. Very similar to Canadian defense, right? We haven't done it because the Americans were doing it. To some degree, if this helps the rest of the world get its act together, maybe, it's worthwhile, you know, never let a good crisis go to waste. But you just hope nothing bad happens while we're gearing up for all of that.
Well, and I guess this is the thing. I mean, Joss, can you picture Canada devoting resources to, helping fund some of the research that is now kind of lying dormant while we don't have enough GPs for our population and we don't
Yeah.
have pandemic readiness and we don't have, the infrastructure we need in place in hospitals? We're fighting for resources.
Yeah, we have a real opportunity right now to step up and partner with the EU, with other European countries to become the new leaders in health research, in public health promotion. What I really worry about, though, particularly with what we're seeing with the economy, with what we're seeing with tariffs, is that it's going to be hard to convince the federal government to invest in those areas when they're very focused on the economy right now. And so asking them to spend dollars on something like health research, which has longer term benefits, but fewer,
Yeah.
not none, but fewer that are benefits in the next year or two. Still, definitely some, as we know, like measles is a great example of where there definitely would be short term benefits as well. But that's where I worry that it's going to be a tough sell, even though we know that it would benefit us as a country, as a part of the global partnerships. We're dealing with a new world order, and Canada is going to be one of the harder hit countries in American policies when it comes to economics.
I was going to add to that and say that, I mean, everybody in Canada knows that our healthcare system's a little bit of a train wreck these days. We have not had serious reform in Canadian healthcare since it was created back in the 1960s. And we always need more money, yet the reality is we have one of the most expensive healthcare systems in the world with poorer outcomes. So I do believe, again, with a crisis like this, that there's an opportunity to really get into what we Canadians, like what matters to us with respect to our healthcare system, because
Hmm.
we're spending an awful lot of money, but we're not making a lot of people terribly happy. And we're far more under-resourced in terms of personnel than many other developed countries. So it is, whatever we're doing, it's not working. And so again, it would be a lovely opportunity to take that deep dive and actually put our nationalism to the side and actually have very frank conversations about Canadian healthcare. Because if we're spending money all over the place but not getting the outcomes, that's money that we're not using for other things. like research.
I'm so glad you brought this up because I feel it has felt to me as though places like healthcare, and I would add education to that as well, that matter so deeply to our long-term prosperity and our immediate well-being. They're important both for me today and also for my grandchildren. Are taking a back seat to kind of critical issues and big mining projects and Joss, I wonder whether. We got a federal budget coming up, Ontario budget this week. Is it a time to kind of remind policymakers that healthcare actually reform, fixing it? Because to Michael's point, spending money on something isn't a sign of success. Outcomes are what matter. Do we need more attention?
When we need to be willing to change how we're spending our dollars. We put a lot of money into hospitals, into emergency rooms, more recently into private nursing agencies. We put money into filling gaps and putting out fires. And that's much like I was saying, it's a hard sell to tell the federal government to invest in something that's going to have long-term benefit. When every government's working in 4-year cycles, it's always challenging to get them to invest in primary care, in mental health, in public health, in the things that we know will actually improve people's baseline health, keep them out of the hospital, investing in home care. We are 23,000 family physicians short across the country, and that's from a Health Canada study. We're not going to be able to suddenly find 23,000 physicians. We need to be willing to be more creative about creating team-based primary care, about investing in public health so people don't require as many health services. There's got to be different approaches than just saying we just need to pay more physicians and nurses to work in the hospitals.
I mean, the family physician deficit is a great one, right? I mean, we keep seeing the news stories about how graduating medical students are not going into family medicine. I haven't heard a lot of people asking, why is that? Like, have we really looked at, and it's not just about money. I mean, I dealt with this a lot when I was in Prince Edward Island with respect to, quality of life, the fact that, my job as a subspecialist infectious disease doctor is frankly easier than a family doctor's. And it's like, we need, again, that really deep look at why are we failing there, but we just want to be superficial, right? And part of our challenge is the 4-year election cycles. I don't have time to get into the nitty gritty about and fix this. I just need to put a nurse practitioner in there, and that's not helpful. All we're doing is just plugging another hole in the boat, but it's still sinking. And our inability to be really critical of our healthcare system, which doesn't mean you're less of a Canadian. I would argue it makes you more of a Canadian because it's such a cherished thing. We should be able to be critical of it. Mm-hmm. And my experience in the Maritimes was just that you cannot be critical of it.
I think whether it's COVID or the healthcare system writ large, we'll agree that asking the right questions is a requirement for our future. We've got to leave it there, guys. Really great to have both of you with us. Appreciate your time.
Thanks so much.
It was a great discussion. Thanks so much.